Thanks very much for attending today's conference. What's your comments about the current situation regarding to COVID-19? Okay, sorry. First of all, thank you very much for attending today's conference. And what's your comments about, our First Lady of Canada has affected by COVID-19? So what's your comments about that, and what's your anticipation about what will be going on?
We wish all the very best for Ms. Trudeau. I know that this has affected not just our Prime Minister's family, but many parliamentarians, including ministers. And I hope the very best for her and for my colleagues, those who are in self-isolation or in quarantine due to exposure or possible exposure to coronavirus. It's very important that all of us take the appropriate steps at this time to protect ourselves and to prevent the further spreading of coronavirus. The Public Health Agency of Canada advises as of today, March 14, that the risk remains low for Canadians. There are, as of this morning, 193 reported confirmed cases of coronavirus, and we will continue to work together with our public health units, ministries of health in the provinces and territories across the country to monitor the situation, to ensure that we continue to be cognizant, to be vigilant. We have many advisories that are being released on a daily basis to Canadians, and there are many tips that Canadians can follow, such as ensuring that they wash their hands for at least 20 seconds, in the absence of hand washing to use a hand sanitizer, to make sure that if they are experiencing symptoms, for example, cough, fever, that they should seek proper medical attention and to consult their local health department on the best way to get the medical attention that they need. As well, we are taking steps as a government to provide $1 billion in a COVID-19 relief fund. That money will go towards helping provinces and territories that are working on the ground to support Canadians. That money will also go, $275 million of it, to research and development, including the search for a vaccine against COVID-19. We are looking forward in the coming days, this following week, to announce economic measures that will be taking place in Canada to help support our businesses, our small businesses in particular, our workers, because people and communities have been affected and the economic impact has been clear of the coronavirus.
Yeah, thank you very much. Actually, today CTCC will host this conference virtually online because the government discouraged people to have a gathering together over 250 people, right? And our today's dress code is encourage people wear masks and to use sanitizer. But we noticed that you didn't wear the mask when you. So can you please tell us why?
I would encourage Canadians to make that decision using the guidance of the Public Health Agency of Canada. The current advice that we have from the Public Health Agency of Canada is that if Canadians are not experiencing symptoms and have not been at risk, for example, they have not been traveling, that they should know that a mask is not something that is recommended. That is if they are not experiencing any symptoms. What is very important is that they follow the other advice that is being provided through the Public Health Agency of Canada. So for myself personally, I have been washing my hands. Where I'm unable to, I have a hand sanitizer that I keep in my vehicle when I travel from one place to another. I am ensuring that I am monitoring myself in terms of any symptoms and also being cognizant of the people around me. The current advice is to not wear a mask, that it's not recommended by the Public Health Agency if you're not experiencing symptoms, and currently I don't have any symptoms. However, I do believe that every Canadian should make that decision based on the advice they get. I encourage them to follow the professional advice of the Public Health Agency of Canada, but they are free to make that decision for themselves and whatever they feel is the best decision. However, the Public Health Agency of Canada also says that wearing a mask can also give people a sense of false security. And people should know that even if they are wearing a mask, it by no means prevents them from getting the virus. The virus, for example, could be through personal contact, and if somebody touches their eyes after personal contact with someone, that can be very dangerous. So there are measures that Canadians should take, and they should do everything they can and believe that is necessary to protect themselves.
Yeah, so what I understand from you is that if the people follow the government's rule, the people with symptoms wear the mask, then the rest of people should be safe, right? So, I mean, if the people with the symptoms, right?
No, yeah. That's not what I'm saying. I'm not saying that people who don't have symptoms should not wear a mask and that they will be safe. Nobody is safe. This is a virus that is spreading, and we need to all take proper care and precautions to protect ourselves. The Public Health Agency of Canada is saying that it does not recommend wearing a mask for those people who are not symptomatic and don't show any signs like coughing or fever. That is their advice. That is a recommendation that they have. However, each Canadian should make that decision for themselves based on the circumstances that they are in.
So basically, it's not mandatory for people who doesn't have a bad feeling or symptoms to wear a mask, right?
Yes.
Yeah, I see.
And the Public Health Agency of Canada is saying that if people are wearing masks, it may give them a false sense of security, so that if they are not taking other precautions like washing their hands or coughing or sneezing into the bend of their arm, then they could be equally at risk of contracting coronavirus. But the mask is a visual. It doesn't mean that it will necessarily protect people. People should make that decision as to their circumstances, how they protect themselves.
Okay, thank you very much. 那么刚才我们问了那个陈胜元国会议员，为什么他今天没有戴口罩？他是觉得他自己今天没有任何不良的感觉哈。那么有不良感觉的人、有症状的人，一定要戴口罩哈。那其他人呢是可以根据自己的情况来做一个决定啊，就是好吧？谢谢您。
谢谢。
谢谢。